Chances are you've probably heard there's a critical shortage when it comes to blood donations, and now the blood emergency is affecting treatment plans for some patients, leaving them having to deal with even more chronic pain.
Blood is life, and for patients with sickle cell anemia, new blood keeps them going.
When their red blood cells don't get adequate oxygen, they change shape, they become rigid and sticky. They stick together in the blood vessels, which can cause a sickle cell crisis, which is a very painful event for them.
Consuela Albright, a sickle cell nurse practitioner at University Hospitals, says sickle cell patients get transfusions to manage the disease. Lillian Kennedy gets transfusions every 6 weeks, but because of the blood shortage, her doctor told her they'd have to scale back to partial transfusions.
Lately, I've been waking up with pain every day.
Kennedy now takes more medications to manage her pain, and she says she had to be hospitalized this year for the first time in 2 years.
It can go from like a stabbing pain to a throbbing pain or just an ache. Sometimes it can feel like it's in your muscle or it can be deep down in your bones.
Sickle cell patients need routine transfusions to maintain their quality of life, and sometimes they need an emergency transfusion just to keep them alive.
It truly affects every part of their body from head to toe. So our goal in the sickle cell clinic is to try to help our patients have the best quality of life they possibly have.
Right now, Albright says the shortage is only affecting those maintenance transfusions, not the emergency ones, but she worries what the future holds.
It's scary to look at an almost barren refrigerator and know that, at any time I could get a call that says, we simply don't have enough blood to be able to treat patients.
So we reached out to the American Red Cross, and it says that this blood shortage is still very much a crisis. And so far in 2022, 600 blood drives have been canceled across the nation because of winter storms. 33 were in northern Ohio, leaving more than 1,100 donations uncollected. And Delon Albright told me every time there's a story like this, there's a surge in donors, but then it dies down again. So if you're considering donating, maybe think of it as a part of a routine for you, and make sure you take a friend too.
Yeah, it is so important to hear that from University Hospitals today and to keep that in mind and not ignore it. Thanks so much for telling us about that, Courtney. And if you are interested in donating, we have a link to donation drives for you right on our News 5 app right there for you.